Hello everyone. We have prepared a presentation based on effects of social media on mental health. Each slide has a summary of the article based on this topic. This presentation is prepared by 15 students with one of them as the group's leader. Let's begin.
The findings from the Health Behavior in Social Age Children HBSC survey, Social Media, Social Determinants and Mental Health by Jason M. Nagata. The article discusses a supplement of research articles based on the Health Behavior in School-Age Children HBSC between 2017 to 2018 survey, which collected data on the social determinants of health, mental health, and social media use among early adolescents, ages between 11, 13, and 15 years in 45 countries across Europe and North America. The survey allows for cross-national comparisons and trend analysis on adolescent health behaviors and well-being. The research articles are grouped into three categories: social determinants of health, mental health and well-being, and social media and health. The article reviews the impact of social media use on adolescents' well-being and how it affects their mental health. There are concerns about problematic social media use and its impact on life satisfaction, mental health, and school and family relationships. Other research articles show that national wealth and income inequality are associated with socioeconomic inequalities in adolescent mental health and well-being. Gender inequality also affects adolescent health, as greater gender equality in a country is associated with higher odds of negative health outcomes for girls compared to boys. Strategies and policies are needed to encourage adolescent sleep and address problematic social media use. Interconnected or Disconnected: Promotion of Mental Health and Prevention of Mental Disorder in Digital Age by Joseph F. Hayes et al. The internet has changed the way we communicate, form groups, and process information, develop relationships, and spend our leisure time. There is insufficient evidence to reliably appraise the internet in terms of harms and benefits to mental health. Research in mental health promotion has tended to focus on issues such as reducing stigma, reviewing lifestyle factors, enhancing socialization, and improving mental health awareness using non-digital approaches. A systematic search of one database, Medline, using appropriate mesh headings and keywords revealed that there was a paucity of evaluation in this area. Of 32 studies evaluated novel digital interventions, 9 used randomized controlled methods and 5 had outcomes relating to mental well-being. 2 systematic reviews have examined the effectiveness of internet-based programs and specially designed software packages to achieve behavior change in areas such as sexual health, smoking cessation, and healthy eating. The target audience of mental health promotion and secondary and tertiary prevention shares some of these characteristics. To fully appreciate the potential of digital health promotion, we need to understand the harms and benefits of internet use and how this usage affects different subgroups. Social isolation is a predictor of poor mental health, and being part of multiple social groups can protect against the mental health effects of significant life events.
Internet addiction disorder and mental health in adolescents. Internet addiction disorder is a condition described by excessive and compulsive use of the internet, which can lead to negative consequences in various areas of an individual's life, including social, academic, and occupational functioning. While not yet officially recognized as a separate disorder in the DSM-5, IAD has been the focus of research and debate in the field of mental health. Adolescents are at a higher risk of developing IAD due to the widespread availability and accessibility of the internet. Studies have shown that IAD can have negative effects on adolescents' mental health, including depression, anxiety, and stress. It can also lead to sleep disorders, poor academic performance, and social isolation. Prevention and intervention strategies for IAD in adolescents often involve a combination of education, therapy, and parental involvement. Building healthy habits around internet use, setting boundaries, and promoting alternative activities are some of the ways to reduce the risk of developing IAD. To sum up, the relationship between IAD and mental health in adolescents is a complex and evolving area of research, with current efforts to better understand and address this issue. The role of social media in reducing stigma and discrimination. Victoria Benton. Social media has become an integral part of our lives, with billions of people using platforms like Facebook, Instagram, and TikTok to connect with others, share their lives, and consume content. However, research has highlighted negative effects on mental health, including an increased risk of depression and anxiety. People who spend more time on social media are more likely to experience these mental health problems, with online harassment, cyberbullying, and social isolation being significant contributors. Social media also affects self-esteem and body image, with idealized images and messages leading to feelings of inadequacy and low self-esteem. This can contribute to the development of eating disorders and body dysmorphic disorder. Poor sleep quality and sleep disturbances are other negative impacts of social media on mental health. People who use social media before bedtime are more likely to experience these issues, leading to daytime fatigue and decreased cognitive function. Social media also contributes to feelings of comparison and FOMO, leading to increased stress and anxiety. It is important to use social media in moderation and take steps to protect one's mental health from these negative effects.
5. The impact of social media in Sri Lanka, issues and challenges in mental health. Rajiv Orisvenda. Suicides and mental health problems caused by social media are a global issue and not confined to Sri Lanka. Social media is ubiquitous in Sri Lanka, with over 2.3 million users spending an average of 34 minutes a day on it. Restricting access to social media is not a viable option. Research shows that social media has an adverse impact on mental health, especially among adolescents. Sri Lanka lacks research relating to mental health impacts on social media, but suicides related to conflict arising from its use have been reported in other countries in the region. Sri Lanka has a highly literate population with a high percentage of internet penetration, making social media a potent instrument among its younger age groups. A more appropriate response to social media's negative impacts will be to use design technology to identify suspicious online behaviors, promote parental supervision, encourage users to report cyberbullying or predatory behavior, and educate vulnerable age groups about inappropriate behavior on social media. Collaboration between law enforcement agencies, internet service providers, the media, educationists, and mental health professionals is required to address the issue. 6. Impact of social media on mental health of adolescents. Samarjit Kaur et al. The use of social media has become a significant part of adolescents, but it has also raised concerns about its negative impact on the psychological and social well-being of teenagers. Various studies have shown that excessive use of social media is associated with health problems including depression, low self-esteem, and eating disorders. Additionally, it can lead to social isolation and aggression. The study recommends that parents should control the excessive use of social media among teenagers, and schools should introduce comprehensive school-based media education programs. The research was conducted in rural Punjab, India, and used quantitative analysis and statistical techniques, including composite indexes, T-scores, and Z-scores, to measure the impact of social media on adolescents. The study included both male and female participants.
Social media use and its impact on adolescent mental health. An umbrella review of the evidence. The article is a review of the evidence of social media use on mental health of adolescents. The review focuses on 25 studies conducted between 2019 and 2020 and categorizes them into 7 meta-analyses, 9 systematic and 9 narrative reviews. The results showed that most reviews interpreted the association between social media use and mental health as weak and inconsistent, while a few considered them as substantial and detrimental. The authors conducted a literature review of the studies to investigate the relationship between social media use and mental health in adolescents. They used 4 sets of search terms related to reviews, social media, mental health, and adolescents. Their definition of mental health included well-being and 2 levels of ill-being, clinical and non-clinical. And the definition of social media use encompasses both active and passive usage on various platforms. They excluded studies that focus on overall screen time to avoid conceptual confusion with other activities. Social impact of social media use intensity on mental health in the form of apathic attitude. The study involved a systematic review of 23 empirical research articles published between 2012 and 2017, that investigated the impact of social media use on various mental health outcomes, including depression, anxiety, self-esteem, and body image. The finding of the study indicated that social media use is significantly associated with negative mental health outcomes, including increased levels of depression, anxiety, and stress, as well as decreased level of self-esteem and body image satisfaction. They also suggest that healthcare providers consider social media use as a potential risk for mental health issues and incorporate this into their patient assessments and interventions. In conclusion, social media use has a significant impact on mental health outcomes with negative effects such as increased levels of depression, anxiety, and stress, as well as decreased levels of self-esteem. While the relationship between social media use and mental health is complex, individuals should be aware of their social media use and take steps to manage it in a way that promotes positive mental health outcomes. Healthcare providers should also consider social media use as a potential risk factor for mental health issues and incorporate this into their patient assessment and interventions.
In recent years, the prevalence of social media has led to increased exposure for young people from an early age. However, concerns have been raised about the impact of higher screen time on the mental health of adolescents around the world. Certain online interactions and incidents such as cyberbullying have been identified as major counterparts to mental health issues among young people. Shockingly, studies have found that 40% of young teenagers use social media before going to sleep, and 36% wake up during the night to check their devices before going back to sleep. It's important to recognize that social media can have a significant impact on the mental health of young people, rather than simply attributing mental health issues with excessive screen time. It's necessary to examine the specific causes and effects. By understanding the root of the problem, we can work toward addressing the negative impact of social media on adolescents' mental health.
It discusses how social media affect the mental health of younger generation. Although social media has several benefits including communication, marketing, and education, its excessive use can lead to negative mental health outcomes like anxiety, stress, depression, and loneliness. The younger generation is particularly vulnerable to these effects due to their increased use of social media. Parents, researchers, and society at large have become increasingly concerned about excessive social media use. The author emphasizes the need of further research to understand the relationship between social media and mental health better. By comprehending this relationship, society can develop intervention to address negative mental health outcomes and promote positive outcomes among younger generations. Understanding the impact of social media on mental health is crucial for navigating the outgoing digital revolution while ensuring the well-being of future generations. In summary, this article highlights the significance of understanding the complex relationship between social media usage and mental health to promote a healthier and more sustainable digital future.
These are the references to all the 10 articles. The references are in IE format. It starts with the reference number, then the first name's initial, then the last name, followed by the article title, after which is the journal title, and then comes the volume, pages, and year. Lastly, the DOI link. 5 of the references are on this page. And the last 5 of the references are on this page.